Good morning. This is Andreas Damianos. I'm a neonatologist here at Phoenix Children's, and I would like to introduce Dr. Winchester, who is joining us from Indiana. He comes very highly commendable for his work that's very significant to our field and the field of pediatrics nationally, actually internationally. He's a professor in the Medical School of Indiana, the clinical director of the NICU in Indianapolis and Riley Children's, and he comes with a significant background, educational and research, very heavily involved, which I found pretty fascinating, from the initial studies in psychology to medical school, and then the whole research of how environmental factors can affect epigenetics and overall health. It's a great pleasure to introduce him and an honor to have him here. Thank you very much.
Those of you who made it early, hello. And I'm sorry about the hour of the morning, but today we're going to talk about a journey that I took with colleagues, looking at the broader questions that all of us as providers are interested in. And that is the question, why is this baby here? Why am I seeing this baby in the NICU, or why is the baby sick? When I moved to Indiana, I became aware that there seemed to be more premature babies there and more birth defects than I was used to seeing. And so naively, I began to ask those questions. When we asked the question about birth defects in Indiana, the first place I asked or called was CDC, because the CDC collects birth outcomes on all pregnancies in the US. And they called me back, which was a surprise, to say that they weren't counting birth defects in Indiana and 12 other states. Now, just as a commentary, I assume all of you are working in pediatrics in some way, right? How many neonatologists? Any? But all of us care about babies, right? So if you were president of the United States, would you count the leading cause of infant death, which is birth defects? Yes, you would have a country that does that. And so when I moved to Indiana in 2001, an important date, 9/11 happened just a month later, they weren't counting birth defects in all the states. It wasn't mandatory. Well, that was the first time I ever encountered what I would call public policy shortfalls. And that'll be part of the theme of this conference. So to explain this, I looked around the community to see if there was some way to measure an environmental factor that affected everyone, not just the little town where they had a iron smelting plant, and not just the one that was contaminated by water. And I found that the U.S. Geological Survey was located in Indianapolis, and they had been testing the water, not just in Indiana, but across the whole U.S. for pesticides. And I thought, well, that's a good way to start. This is a picture of NAQUA, the National Water Quality Assessment Study Program that Jeff Fry introduced me to. And you can see that almost every state has measurements made in their surface water for pesticides. And so we're going to, I guess we're going to go to a quiz and a set of questions. I haven't given you the answer yet, so don't be sad if you. So the major source of glyphosate is in human populations. It comes from what? Now, I haven't even introduced glyphosate to you, so apologize for that question coming too soon. But glyphosate is the active ingredient in what amounts to the world's largest, most heavily used herbicide in the world. Most of you know it by the name Roundup or something like that. How many of you have ever used Roundup? Everybody. So the question we will come to is how much of that is a problem to us? So sorry about this this question because I haven't given you the answer. I'm going to let. So what does it look like? If you look at the NAQUA study? What I found was really exciting. And this is a picture of our campus in Indianapolis, and in front of it is the White River that kind of surrounds it on four sides, and it's measured in every year for pesticides, and you can see that every year in June, the pesticides reach their peak. Now the critical months are April through July, and it turns out that's the same across the whole country. A little bit sooner in southern part of the country and a little bit later in the northern parts, but a very nice signature of risk if you were an epidemiologist to ask the next naive question. And by the way, all of my questions are naive questions, so don't feel, and that is, if you were to ask, do the birth defect rates vary by mothers who conceive their babies? I don't know if there's a pointer on this or not. That was one thing we didn't talk about. Oh, there it is. Yeah. So if you were a mother conceiving in January or February, would you have a different risk of birth defects than a mother who was conceiving in June? It's a very simple question. And the answer, if we were able to plot the birth defect rate by mothers by their last menstrual period, we could easily rule pesticides out. If the graph pretty much just went across like this. Agreed? So that was our first naive question. And as you know, birth defects are a special outcome of pregnancy that can only be caused by something in the early phases of pregnancy. You can't develop a birth defect of the heart after 14 weeks. So it was a convenient place to start because last menstrual period plus a little bit of time was the major place in which birth defects could form. That's why I'm showing you these slides. One other little thing I learned here, which I have to apologize for admitting that I didn't know this. When the obstetricians track a pregnancy, and they tell you that you're due in 40 weeks after your last menstrual period has begun, what you don't really know deep down is that your baby doesn't exist for 2 of those weeks. It's considered a week of gestation, but there's no baby until you ovulate, which is 14 days into the gestation. So all the embryology textbooks show fetal age according to the fetus, not the obstetrician. So you have to subtract two weeks for all the things that matter. Anyway, the question is, what did we find when we did this? Well, we found this. We found that birth defects fit the pesticide graph like a hat, like a Mexican hat. And that we thought was important. Now, the EPA and my lawyer friends don't agree with me that a correlation means anything. But I would have countered by saying, it doesn't mean nothing. Furthermore, when we published this paper, we looked at individual birth defects. Now, you'll find that most studies in humans fail to find significant associations with individual birth defects. And the reason is not because they're not related. It's because every individual birth defect is so rare. You have to have millions of patients to show that cleft palate or cleft lip is significantly affected. But fortunately, with the CDC data, those kind of, does this change colors? I have to go back just. So what we found was that, remember that Indiana wasn't counting birth defects, but they were using the standard birth certificate. Now, most of you know that the birth certificate is collected and processed within days of birth while the mother's still in the hospital. So the only birth defects that it can count are those that are visible at birth. You could be argued that everything is a birth defect, even if you die of it at age 50. You know, what we'll show you is that epigenetic changes caused in pregnancy, you can't see until then, but they were caused by birth or by pregnancy. But at least of the 22 birth defects that the CDC did count in every state, 11 of them were significantly higher in the April through July. See that on this. Spina bifida was one of the first ones we looked at, and it just went oink. And it was a shock. Now, this was new. Seems hard to believe that this such a simple question could not have already been asked. But notice that the ones that didn't reach significance, almost all but 2 of them were actually still higher in April through July. My statistician does fight with me sometimes, you know, because I said, it means something. And he says, no, it doesn't. But you can see that this could be important. And so as it turned out, we learned something from this when talking to our colleagues at the EPA and this federal government that makes regulations for pesticides. And that is that the US regulatory system does not operate in the same way as the European system, which uses what they call the precautionary principle, which would have said if pesticides are correlated with birth defects, without knowing the mechanism, without knowing the why, we should be cautious. And in this country, that doesn't happen. So we then looked at another measure of pesticide exposure, which is what county you live in and how many pesticides are found in your county. We found a strong association between pesticide in your county and birth defects. We found if individual birth defects, and with my research colleagues, Dr. Markle, pyloric stenosis. Really? Hypospadias. Really? So the next question was to go to the second leading cause of infant death, and that is what? For those in neonatology, it's premature birth. Now, it could be argued that premature birth is actually the most important health problem in pediatrics because it doesn't just kill you. If you survive it, it causes a lifetime of other complications. So by far the most serious, affecting the majority of children that you practice with. But already you in your practices, you already recognize that birth defects is a big part of what you take care of. And then the other part is the chronic diseases that you see. So we thought, let's ask the same question about preterm birth. And we were going to use the California pesticide use data to help us with that. And don't you want to know what we found? So what we found was that if you lived in a county with low pesticides, at the green counties, the impact of premature birth across the seasons, across the months, didn't really vary that much. But your pregnancies lasted longer, significantly longer, than if you had medium or high pesticides. So the first obvious thing here is that shortening of pregnancy is a consequence of pesticide exposure. The black line shows you the sort of outline of California pesticide use. And notice that it stretches across the June period. And if your pregnancy is ending in those months, you can see that it has a significantly shortening effect. I need to bring up the dilemma with preterm birth was which part of pregnancies does pesticide exposure affect preterm birth? And of course, there could be something at the beginning, the middle, and the end. And what we're showing you is what happens if you have a graph of preterm birth rates by birth month. It suggests that the pesticide exposures towards the end of pregnancy is the most impactful. You can see how that graphs. So now we have the second leading cause of infant death impacting and being impacted by pesticides, at least correlation. Now, shortening of pregnancy is the inverse of preterm birth. So you can see on this graph, the preterm birth rates are highest in those same months. And that graph has actually been verified many times now. I call it the June effect after my wonderful statistician, Jun Ying. We get a kick out of that. So here we are, the association between pesticide use and preterm birth is significant. And these slides are meant to show you how important preterm birth is for your lifetime. And one of the things that Dr. Andreas and I have come to recognize is that babies that are born early have not completed their maturation of their organs. Their lungs are smaller, their bodies are smaller, their brains are smaller. And in Europe, they've been able to show that gestational age alone can predict your IQ. Unfortunately, it's a descending variable. The smaller you are at birth, the smaller your cognitive ability will be. And think of the impact this has on your entire life. It's not the only thing, but it's a big thing. And it also points out that if you go post dates, you're also going to suffer the consequences of placental insufficiency, and that is measurable in IQ as well. So these are important things to know. I don't know how many of you regularly plot your children by their birth weight percentile, by their head circumference percentile, and by their gestation. But those almost define the biggest problems that they'll see through the rest of their life. So because correlation is not causation, we had to go to the next stage of proof, which is to measure mothers that are pregnant for pesticides. And in this case, we chose glyphosate, the most heavily used herbicide in America. Here's another one of those public policy failures. Glyphosate had never been measured by the CDC, who does regularly measure pesticides in the human race in America, never measured by the US Geological Survey that measures all the other pesticides in surface water. And my colleagues in those fields said, well, we just don't have a method for it. We didn't. It isn't that the biggest company in America had any influence on this, but they hadn't measured it, and they said it was hard to measure. And besides that, it's known to be safe. So we took a big chance and decided to collect a group of mothers that are pregnant, look in their urine for pesticides. I found an analytical chemist at San Francisco, that Roy Hirona, who actually could measure it. He said, I could measure it. And so we measured their urine. But I have to remind you that as Andreas and I were talking, they don't give you money for this. The federal government doesn't give you money to discover something. You have to have already discovered it before they'll give you money. So we had to do this on our dime. And the great fear we had was that we're going to measure 100 women, which costs a fortune, and we won't find anything. And so that's the question. These slides show you the question that we should have asked 45 years ago when glyphosate was first approved for use in the US. And so we did. And get ready for this set of questions. What do you think we found? What percent of women, and again, we were so fearful that it would be less than 10% and we would be on the road again, so to speak. There's an answer coming. And Yeah. So the first cohort of women, the low risk women that our obstetrician group was willing to share with us, 93% of them had Roundup in their urine. The next cohort had 99%. So we can safely say that almost all pregnant women are exposed to glyphosate. Now, in our study, we also asked the women to bring in their drinking water sample, and we sampled that because we didn't know where the glyphosate might be coming from. Now, this is a question that wasn't on here, but how many of them had Roundup in their water? None. It turns out glyphosate's other chemical effect is it's a chelator. It's very easy to remove with a water filter. It'll attach itself to anything. So they weren't getting it from their water, and yet all of them had it. And most of them weren't spraying Roundup on their ranches and farms like some do. Where was it coming from? So that'll be your next fun choice. So when we measured it, and then we asked, as neonatologists can ask, what are the outcomes of pregnancy? And I will point out that most of the studies on pesticides are being done by epidemiologists that aren't doctors and don't know anything about babies. So they publish paper after paper showing that pregnant women today have chemical after chemical after chemical in their bodies when they're making a new baby. The end. And for neonatologists, that's not the end. We want to know, how did the pregnancy outcome end? Well, would this shock you to find that higher pesticide levels, in this case glyphosate, shortened the pregnancy? We've already seen that, haven't we? And preterm birth rates were increased with higher levels. And birth weights were reduced. So even at an earlier gestation, the birth weight, normally at 50th percentile, how many of you use these growth curves? These are the ones that actually were created by my mentor in Denver, Lula Lubchenko, the first intrauterine growth curves. You notice the shape of this curve, it goes straight up until about 38 weeks, and then it starts to taper off. You know why it tapers off? Because of placental insufficiency. And the ones that these graphs were made in Denver, Colorado, which is 5,000 feet. So it's worse there than it is here. I don't know, what is the altitude in Arizona, in Phoenix? Is it a little bit over sea level? So your growth curves won't taper off quite as much. Your babies will be bigger. Anyway, so those are the important outcomes, and I want to remind you that these are, when we made these discoveries, we were able to then stimulate a lot more research done by others. The CDC then developed a method, and they measured it in all the population of America, and they found that every man, woman, and child in America, 85% of them have Roundup in them. Good to know 45 years after it was released into the environment. Secondly, the NIH-funded groups that have been measuring large numbers of pregnant women were able to show that not only does it shorten pregnancy, cause premature birth, verifying our findings, but it also increases the risk of neurodevelopmental problems in the children. So this becomes a big deal. This is a reminder that smaller is not better. These are identical twin studies that show that even if your twin is identical to you genetically, the likelihood of that child having a slightly lower IQ than its twin is directly proportional to how different in weight they are. So being smaller is not good. The Barker hypothesis showed us that the smaller babies are more likely to grow up obese with hypertension, heart disease, earning less in life, and all those things. One of my colleagues, Shana Swan, was also famous for having discovered the role that plastics play in endocrine disruption. Plastic, I'm not talking about the particulate, but the PBDEs. And she found that the feminizing effect could be measured in males' scrotums. Littler wieners before with higher pregnancy-related endocrines. Well, it turns out that glyphosate has an endocrine effect as well. It masculinizes the female genitals. Now, if it masculinizes a physical trait on a person, could it possibly be influencing the mental aspects of that person? These are questions that haven't been yet answered, but I can't imagine that they're unrelated. So along comes my greatest mentor and colleague, Michael Skinner, who could do the rest of the study that needs to be done, that you will never be able to do in humans. What happens if a mother gets exposed to glyphosate versus not? What happens to her next generation and her next and her next? In his study with rats, he can do all of that in 3 years because of rats' convenient shorter lifespan. And by exposing the mother, the fetus gets exposed. And what he found was that if you wait till adulthood, you see all kinds of diseases and disorders that the EPA never would have seen because they euthanized their rats at teenage. But low sperm count, infertility, cancer, kidney disease, prostate disease, pregnancy abnormalities, immune dysfunction, high cholesterol, accelerated aging, a non-sexy scent means they have little boxes in which a female rat is offered 2 male rats, but she can't see them. She can only sniff them. Now, you know, women can smell anything, but they universally chose the one that hadn't been exposed as a fetus, which has tremendous implications. Anxiety, these are just a few things you can measure in rats. In rats, you can't measure premature birth. You can't measure autism, but look at what he found was that you get generational effects on cancers, prostate disease, kidneys, testes. Interestingly, PCOS is a very common thing to find. And what he learned was that for this to be a generational effect, an inherited disease, it couldn't have and stay at the same frequency. It couldn't be genetic. It had to be something else. And so he measured epigenetics. This is a little cartoon to show you what that is. When I was in medical school, we didn't know anything about epigenetics, but this is a cytosine nucleotide sitting next to a glycine. And if it is sitting next to it, it will be methylated. And when it becomes methylated, the methyl group becomes a blocker of transcription. So across the genome, that's a so-called CPG site, which is optimal for a methylation. But it links methylation to everything that we already kind of know about it. For instance, we know that folic acid is important in preventing birth defects. Folic acid is the methyl donor of the chemistry set. And those exposed rats had methylation sites that were new, covering the whole genome. In fact, every pregnancy exposure caused a change in the epigenome. And this shows you that the change in epigenome does translate into differences in gene expression. The hippocampus is an important organ in the brain. Anybody know what it does? The psychologists know that it's the short-term memory store. It's a big deal. And here are exposed and non-exposed rats, and you can see the gene expression is dramatically changed. Now, we're not saying how it ends for the poor rat. The amygdala is another important organ. It's the fear center of the brain. And again, have we seen an increase in anxiety in women that are pregnant? thoughts on that? I can't remember when I've met a pregnant mother who wasn't on an anxiolytic. It's very common. So in Skinner's work, he has tested many of the contaminants, plastics, dioxins, DDT, et cetera, that are all found in pregnant mothers now. They're universally found. Polycystic ovaries, look at the incidence of polycystic ovaries and exposures. It's a universal outcome. And when I was growing up, I didn't know any woman that had PCOS, and now I don't know a woman who doesn't have it. It's very common. Anyway, the short version of this is that glyphosate has a profound effect on the outcomes of the rats. And the biggest one that's the most visible to us all is that in both males and females, by the second generation, you get obesity, and 60% of third generation have inherited obesity. Now, the last time you looked at an obese child and said, you're eating too much fat, you're playing too many video games, you're eating too many McDonald's. Now, these rats didn't have video games, and they didn't live near McDonald's. They were unfortunate enough to have great-grandmothers who got exposed to Roundup for 1 week in their pregnancy. Now, glyphosate is not the only obesogen, but it is we've mass exposed ourselves to an obesogen. There is some good news, though, because the millions of dollars, the billions of dollars that were made selling Roundup has now been compensated by the $1 billion that are now being made by selling GLP-1s to treat one chemical with another, or not. Anyway, so our great discovery is that this is the number of contaminants that Tracy Woodruff first described in pregnant women, and it's just overwhelming. We never realized that we've changed the biology of pregnancy that much, but now we have a new one. You can add Roundup to the list, but look at 100% of women have these other chemicals in them all the time. So in our study, we are following up the question of obesity to ask, is obesity bad for pregnancies? And these slides we presented a few years ago at Pediatric Academic Society. This graph here, I hope, yeah, this shows you that regardless of your risk profile or race, and yes, there are differences among us in terms of obesity. Some of it could be attributed to the history of our exposure and stress and so on, but you can see that obesity has an epigenetic basis. It can't be something else because everyone has it, and more importantly, everyone's getting worse at it. So the universe of pregnant mothers in America today, every year, is more obese than she was in a year ago, and the rate of rise is across the board, regardless of risk. This is not good. Let's just start with that. Furthermore, it might very well be the consequence of chemicals that are in our environment, and let's talk about that. Sorry. The rate of rise, it turns out, is highest in the lowest risk groups. These are the lowest risk groups. Asians are the lowest risk, but their rate of rise is even higher than the highest risk group. Well, as you increase maternal pre-pregnancy BMI, this is before pregnancy, the APGAR scores drop, the NICU admission rates rise, the number of hours of ventilation rise, the risk of seizures rises, the risk of death rises. And this is neonatal death, but maternal death rises as well. It was just reported last year that America is one of the few developed countries seeing an increase in maternal deaths. And it does other things. These chemicals alter us in an endocrine way, such that the onset of puberty has been declining rapidly across the world. Now we have 10 and 11-year-old girls reaching menarche. We have males having premature onset of puberty. These are the premature birth rates. I wanted to show this slide only to show that, remember I told you that the U.S. Geological Survey was not measuring Roundup. And we kept finding, both for our birth defects and our premature birth rates, that there was a peak in June, like I said, but there was a little peak in October too, and that was not explained by their graph. Well, that's because they hadn't measured Roundup. You can see that Monsanto had found that if you take wheat, barley, and oats, which are not genetically modified plants, and you spray them right before harvest, it kills them and accelerates the maturity of their seeds. Desiccation, they call it. So this way, they've been able to contaminate virtually all food products because the residue in wheat, barley, and oats is the highest. So oatmeal had 22 parts per billion. It's just a kind of here's the incidence of PCOS. We also found that the I-STEP scores, those are the academic achievement scores that kids get in their high school, also seem to correlate with birth defects or with pesticides. And I think you can imagine this might be true. That my son had an IEP, and you could predict that based on stuff. And this is just from those of you who are interested in psychology or psychiatry. This comes from China, but I guarantee you this is the next. You see in China that the mental disorders of children that become manifest by childhood peak in those born in June. So we have yet to measure that in America, but we expect to find that. This is our lifespan based on our month of birth. Showing that it even affects our lifespan. So as pediatricians, I don't know if Bailey did make it to the conference. Somebody that works in the administration across the room, across the hall, has said, this is what the average person will tell you. I've always been worried about vaccines and about food and contaminants, and whenever you talk to somebody about it, the doctors, give you the stiff arm. They don't believe you. And I said, I hope you're going to come to this conference and sneak in, because this is what we've failed as a group of providers. It failed to spend some of our time figuring out where these conditions come from. I know you have to treat the patient as the problem that's before you, but our job is also, we were the first ones to do preventive medicine, to give vaccines that would mean they didn't have measles, where you could run up your bill taking care of them with measles. You've stolen some of your revenue by preventing a disease. It's a guilt trip that all physicians should have, that we make money off of illness. We should continue to be very, very sober about that. We don't do healthcare, we do sick care, but we could do healthcare if we spend a little bit more of our research time and effort. And one way to do that, in her case, was she said, I don't know what it was. All my family members have gotten cancer of one kind or another. My child has ADHD. I'm trying to decide whether to give him Ritalin. But my grandfather was a cotton farmer, and he sprayed pesticides all day long. My grandfather raised sheep, and he ran the whole flock through pesticides to get rid of ticks. And everybody in my family in the male side has had prostate cancer. And just saying that if we look upstream a ways, even ask the question, it's not a standard question, but where did your grandparents grow up? Because it's really, that's where your problem began, not with your video games. Just saying. Now, the final sobering note is that all of these chemicals cause reduction in sperm quality and sperm number. And the world's reproductive rates are not wholly dependent on sperm. As women know, you have to have ovaries that are ovulating too. But the graph in the bottom, Shana Swan showed, one down here, shows what's happening to sperm counts worldwide. And she predicts that by 2050, human race will not be able to reproduce naturally. This is not good news. The NIH had a huge National Children's Study grant to study what needs to be done, is studying women from the time of preconception all the way through life, as public health systems in Europe do, where they can connect your birth with your death and everything in between. But they were unfunded by the time their cohorts ended their pregnancy. But what did they find? If they ultrasound women during the pregnancy and measure the size of the baby, what they found was that these chemicals, organochlorine, pesticides, flame retardants, PFASs, estrogenic PCBs, and so on, these are the fetal sizes of head length and head circumference. And it's very disturbing. Very significant reductions in size of brain and body with increasing levels of these contaminants, which are universally found in women. So this just reminds you that we're on a race to change something that's not good. ADHD rates have gone up. Autism rates have gone up. This can't be the result of genetic changes in the human, but it can very well be related to the epigenetic changes. So what do? Well, let's start by reducing your pesticide exposure. Eat organic is the short answer. And yes, it's more expensive, but no, it can't completely eliminate. I was disappointed to find that my organic honey still had traces of glyphosate in it. But I thought, it's hard to teach a bee not to go to the flower. Even Ben & Jerry's ice cream had it in it, but less. So the dirty dozen, these are the clean ones. And these all have in common, for the most part, they are covered with a shell or something that keeps their kernels clean. And then the other part is to recognize that the harm level is measured in epigenomic measures instead of gross. You know, we always ask questions about, well, what did you do last? What did you eat yesterday? And it's not yesterday that mattered. It's what happened 3 generations yesterdays ago. But for now, for us, less is better than more. And someday we'll hopefully be able to reduce the epigenetic markers. We recognize them as disease markers. We're using them in cancer now, and even in cancer therapy, they're doing epigenetic studies. We're doing the same thing with genetics, but epigenetics is something we caused and we can undo. Simple act of legislation. And you know how simple that is. All right, well, that's the end game. Thank you so much. Is this the Q&A moment? Yeah, anybody ask a question, please? Yes.
You gave us like some lists of that seem to be safer, but is there any legislation that's actively trying to get pushed through? to support?
Well, there was some news just last week that I was going to add to the talk, but glyphosate, the Roundup, was considered by the EPA, and they decided not to regulate it. It's a national what's the right word? Defense requirement. So we're saving the world from starvation, and that's the penalty that we're going to all pay for that decision. But in general terms, the way we regulate depends on the sort of pendulum swinging one way and the other, but it has failed fundamentally to protect us. We have been allowed to become saturated with chemicals, many of which have never been made in the universe. They're man-made and they're made to be eternal. They were actually made not to break down naturally. PCBs were invented to be housed in these transformers that you see, the big buckets hanging on all the electric lines. They didn't want this oil to catch on fire when it got hot, so they made it so it couldn't be degraded. And now it is so permanent that you can be measuring your child's IQ by how many fish you eat that were in the Great Lakes, which are all contaminated with PCBs. Good to know. They don't, and what the government has decided to do is have fish advisories, as in only eat one of those fish. That's their, and I'm telling you the same thing with organics. It's not completely free, but it's much better. But who can afford organic food? The average person can't. More questions?
That's a question online regarding the term organic food. And has this been standardized across the border, or this is more of a marketing term? This is actually, I cannot answer it.
Well, it's a pregnant question, because everything that eventually gets controlled by the government will eventually be influenced by both sides. And the one side has $1 billion and the other side has just you and me. So every regulation ends up getting modified to the point of being eliminated. Several of the pesticides that were banned 10 years ago have now been restored and legalized. So I think you have to trust. We have an agency that's independent of the government called the Environmental Working Group that measures contaminants in food, and they will offer you the information they have. They're privately funded. That's what we all need. We need to know what's in our food, and the more of us ask those questions, the more of that will likely happen. For all of you, just the knowledge that there's much more to know before you, as you talk to your patients. And when they ask these questions, it's honest to say, I don't know the answer, but I think you're on the right track. You should be concerned.
There's another question.
Another question?
Yeah. Does the data of the national NEDMP also being used in the study, like the National Bird Defect Monitoring Program?
Yes, now I think near all the states do it. I found them singularly uncooperative when I first started working with them. In fact, several states refused to share their data with me. Why would that be? The state health departments, which sound like the right thing, are actually they work for the governor, and anything that makes the governor look good is good for them.
She also does a wonderful talk, wonderful.
Now you notice the people online are more courageous. They're asking questions. Any other questions? Yes.
I think a lot of us are very interested in how we can both empower our patients with information and advocate for changes to the system, which you touched on is challenging because of all of the far more powerful interests in hand, including,
Yeah.
the capital businesses of Monsanto and others. So any like concrete.
Yeah, so one of the basic things, and I'm on a committee at the AP on this, which I find is, I thought it was a relief to leave the academic world and not be censored by quite as much, but actually they're more censored. So you have to be careful, but I think the most important thing at the bedside is that we have a tendency to blame the patient for obesity. We have all kinds of subconscious ways of blaming them. And there's just another way to approach it. Start by saying it's not your fault. And it isn't. It's not, neither is it your fault that you're anxious, that you have schizophrenia or ADHD. And the most important thing to know is that every disease is partly heritable, which means they had nothing to do with it. And yet all of us had something to do with it, if you know what I mean. So it's really, I think that's a great starting point. And then say, okay, you have been, this is the deck of cards you've been dealt. This is your hand. And it was handed to you. You didn't choose these cards. How do you deal with it? If you have the susceptibility to addiction, it's a highly heritable trait. It's not something, made by decision. It was handed to you. You have 6 times the risk that I had of becoming addicted if you get exposed just once to alcohol or drugs. That your addictability score is built in. And how many of us have just couldn't help ourselves when a mother comes in with an addiction? We blame her. We feel bad for the baby, but it isn't. But she herself was the 17-year-old descendant of a heroin addict. It's not her fault. And so the job she's been given to try to overcome this is monumental. The best you could do is help. Help her paddle her canoe upstream, and as hard as that is. It's another way. Another thing is just when you take the histories from families, include the background. It really matters. This Bailey just said, well, my great grandfather raised cotton, and I know that cotton is one of the most heavily herbicide used. This is where Roundup is used. And we know that cancer is one of the outcomes, even if it hasn't been proven yet to the satisfaction of regulators. And that doesn't mean we blame the farmers either. I came up on a farm and ranch, and you give pesticides so the cows don't have to suffer from flies. But we can do better. By the way, we all use chemicals. We use chemicals to treat infection, and we know if you do too much of it, you'll have resistant bugs. We're trying to be good stewards. I will tell you that it's not being caused by you. The resistance of organisms, they found it in the pastures in Fort Collins where cow poop is spread across the land from feedlots. And I didn't know this despite the fact that we raise cattle, that all the feedlots are using chemicals to keep antibiotics to keep the cows from dying from being overfed. And so the bugs that are resistant are right there in the pasture. They are using tons of antibiotics, and you guys are using milligrams. Monsanto got its breakthrough gene, the resistance to their chemical. They were the first to make a genetically modified seed. They found the resistant gene in their courtyard, in the mud surrounding their factory, where a bacteria couldn't survive without becoming resistant to their bug. Convenient. But that was the first genetically modified seed, was to not be improved as a seed, but to become resistant to their chemical.
It's fascinating.
One other comment. Thank you for the transparency and candid presentation. And another is, there are a wealth of information in that data bank.
So and I think the other thing would stand before you as having been one of you for years. Our first job is we feel like we just barely can keep up with learning what it is, what we're supposed to do, how to recognize disease and how to treat it. And that those treatments have come from the ether of experts. Well, each one of you is an expert. And as you get more and more confident and experienced, recognize that you have this treasure. Your lab is your patients. And all you have to do is explore in a more deeper way. Are we seeing more of this? Why are we seeing more and more of this? We were the ones who discovered the opiate epidemic when it was happening, because my NICU used to have one patient that was withdrawing, and now half the unit was withdrawing. We discovered an entire conspiracy to make us all become robotically treating people with opiates. We were victims of that very process, but it starts by counting. We're a country in public health that still doesn't count things like birth defects, or how many of you, when you grow up, have cancer or COPD. So you have a really privileged beginning of life, the most precious part of our lives, mission. You're the ones, the caretakers of that, and hopefully also going to be participating in observations that you can share with others or do yourself. You don't have to be a PhD or have a rat lab to be useful in discovery. It's probably enough. Okay.
Right on time. Thank you.
That's my monarch butterfly. I hatched myself.
Thank you, everyone. Have a good day.